How are we reimagining public safety? In 2019, City Council asked our office to come up with new ways to respond to emergency situations without police. After surveying over 8,000 people and analyzing over 23,000 individual responses, what we learned through that process was that people really wanted something new. So we responded by designing a series of pilot programs. Prior to the launch of the BCR, the Minneapolis Police Department responded to, on average, over 5,000 mental health emergencies per year. Most of these calls didn't require arrest and presented little to no imminent harm. It was clear that we needed a new way to respond to mental health emergencies in Minneapolis.
The Minneapolis BCR is a team of unarmed first responders who are mental health practitioners and professionals. We're highly trained, culturally sensitive, and we respond to 911 calls throughout the city of Minneapolis. The vision of the Minneapolis BCR is to meet community members in crisis where they are and support them in returning to a more stable situation. In this pilot phase, the BCR team operates 24 hours a day, 5 days a week. We will expand in the future to 24/7. What makes the BCR unique is that we work really hard to reduce certain barriers to engagement with a first response entity. For instance, you might maybe feel a little bit hesitant to interact with a first response entity if you have to give certain personal information. The BCR doesn't need to gather all that in order to provide our service. When responders come out to the scene, they are dressed casually. You're having a team of individuals who are showing up and asking what you need, showing up as peers, as fellow community members. Another unique part of the BCR team is that we're culturally responsive. Cultural responsiveness for this team means we staff and hire folks who look like the community, who speak the language of the community. We have teams assigned to specific precincts and wards, and so each team gets to know their area very well and gets to know the community that they serve. So we've taken average 150 calls per week and about 2,500 calls total. So far, the BCR has provided services in all 13 wards and all 5 precincts.
If you or a loved one are experiencing or witnessing a mental health crisis, you should call 911. Our team will help assess the situation and determine your need. If appropriate, our team will dispatch the BCR team. With this pilot program, our 911 dispatchers were given additional mental health training. We are looking forward to adding embedded social workers into the 911 center. Doing this will allow us to better understand the intersection between public safety and mental health. For the past 13 years, I've been working to provide the city with the access to the help that they need. I know we can do better. I'm dedicated to turning my imagination into reality.
We are working together to reimagine public safety through alternative responses. We are more than just a group of people. We may work for the city, but we also raise our families here, send our kids to school here, make friends and memories here. We see and support the fight that's in the streets because I also want to be safe and want my family to be safe when interacting with our public safety system. So we ask that you continue to join us in that fight and that work so that we can continue to evolve our system as we know it.
I am Minneapolis.